You're watching Carolina in the Morning on Fox Wilmington.
Well, as is typically the case, Thursday set aside for us to talk about medicine. Today, specifically, we'll go cardiology, heart health. Dr. David Weaver, a cardiologist with the New Hanover Regional Medical Center Physician Group here to talk. We'll even go more specific about heart health, statins, and some new guidelines with that. Doctor, what do you have?
Well, the AHA and ACC, the American Heart Association, released new guidelines for the treatment of hypercholesterolemia a few weeks ago, and there's been a lot, they've been in the news a lot because of that, because of some big changes in the way that we manage people with high cholesterol. The new guidelines basically recommend that anyone with known heart or vascular disease, anyone with diabetes, anyone with a cholesterol, a bad cholesterol, a low-density lipoprotein or LDL level greater than 190, or people with a 10-year cumulative risk of heart disease greater than 7.5% be treated with statin therapy.
How big of a population are we talking about with that?
That's a huge population. You know, obviously, cardiovascular disease is the most prominent disease in our society and the biggest killer in the United States. Diabetes is a burgeoning health issue and is an epidemic currently with obesity. And in addition, with the risk factor calculations, the new guidelines would lead to millions more people being treated with statins than are currently being treated.
I know I was out and about earlier this week, and I won't name the person by name, but I was talking to a football coach, and we were kind of comparing the medicines that we were on, and he mentioned that the statin basically saved his life.
Sure.
With these new guidelines, how many more people could this now be saving?
This would probably apply to, in the United States, you know, several million, you know, probably tens of millions of people that would be treated. These are the most potent drugs that we have for the primary prevention of heart disease, people that haven't had manifest heart disease that we want to prevent from having it, and for secondary treatment of heart disease, people that have known heart disease where we want to prevent current or future events. These are really the medicines where we have the best evidence that they help to prevent future problems for you. And I recommend to patients that they, you know, a lot of times think of taking their cholesterol medicine as preventive maintenance. If you would get the oil changed in your car every 3,000 miles to make it last longer, you should also want to take your statin to help your heart and your blood vessels last longer.
When you see people that are needing to take these, what age group are we talking? When do you usually see this as setting in with people?
The new guidelines really recommend therapy for people greater than age 21 and less than age 75.
Okay.
So this is a very common issue for people, you know, in their midlife forward.
Sure. Okay, and again, I always like to end these things with saying that if you have any further questions, you don't want to turn to someone like me. You always want to go to the person wearing the white coat. They're much more educated in this. Consult your physician. Again, the new guidelines just out, so if you do have any questions, you'll want to speak specifically